Rural Alaska, some of the most remote villages in America. Weather and living conditions as severe as any on Earth. No roads in or out. So what happens when someone gets sick, or breaks an arm, or finds there is something terribly wrong with their child? The health aides in the local clinics are good, but not equipped for the more serious accidents or illnesses. And the doctor, the hospital, is hundreds of miles away.
In the past, many rural communities were on their own. They were disconnected from high-level urban-based care settings, and they just had to deal with it in the darkness or the middle of winter and do the best that they could.
So it's a challenge. It's a challenge when somebody is acutely ill and they have to come into the hospital. Very often people get weathered out just waiting for weather to clear so you can land in a particular remote hub or remote village.
In the Yukon-Kuskokwim Delta, GCI has established a high-speed terrestrial broadband network linking some 50 local clinics to the regional health center in Bethel and to medical centers throughout the world. Called DeltaNet, it's a package of video conferencing and computer technologies that brings urban-based doctors and medical professionals together with rural village patients, face-to-face, as if in a single room.
Now with DeltaNet, we're able to provide electronic medical records using the telemedicine cart. We're able to bring the information to the doctor, and the doctor can then review that case and give a diagnosis. It cuts down on the amount of travel expenses, and the patient care that we're able to provide is increased tremendously.
A major feature of DeltaNet is interactive video conferencing. One important application is telepsychiatry. Here, a psychiatric patient in Bethel visits with her psychiatrist. What's amazing is that the doctor and patient are separated by thousands of miles, yet only by an instant.
I've been doing fine.
A young boy in Bethel recovering from inhalant abuse visits with his mother in a distant village.
Hi, son.
Hey, Mom.
A dentist examines a distant patient by telemed photo.
It should come out on its own and it shouldn't be a problem.
The health aide in a local clinic uploads photographs of a patient's wound for a distant specialist to recommend a treatment plan. An audiologist examines a baby's ears for infection.
Okay,
These are just a few of the important ways DeltaNet is providing the people of the Yukon-Kuskokwim Delta a fast track to healing. New facilities and new services are constantly being upgraded. Here, technicians install telecommunications equipment in a new sub-regional clinic in Hooper Bay. And there is more to come. Because DeltaNet has been such a proven success, GCI envisions expanding the network to serve rural villages throughout rural Alaska. It is a life-affirming vision that can be made real.